Hello everybody and welcome to a policy debate from the European Parliament. And today we're going to be talking about investing in chronic disease prevention and control for better health in Europe. I'm delighted to be here and particularly being joined by two MEPs who are hosting us. Let me pass the floor to Sarah Surdis and after to Tilly Metz. Sarah.
Thank you. Hello, everyone, and welcome to the European Parliament. It's a delight to come here and debate such important issue, which is number one biggest killer in the EU, which are non-communicable diseases. So I look very much forward to the debate.
Also from my side, very happy to be among you. Thank you for the invitation and looking forward to the discussion and also to be able to react on that. So very important topic. So looking forward to that. Thank you.
Thank you. And of course, this is a really important year. This is a year when we have a change in the European mandate. In the next few months, there'll be elections for the European Parliament. And if this election is like previous elections, between a third and a half of the MEPs who arrive will be new. This will be their first time inside the European machine. So this is an opportunity to present to them what's been done so far on chronic diseases and what's the opportunity, what are the steps they can take to make policy and legislation changes that will affect the health of the population in Europe. This is important because next year in 2025, there will be the fourth UN high-level meeting on non-communicable diseases. And Europe will want to go with a strong message to see what they've done to tackle this huge burden of chronic disease, which sadly is growing. As our population ages, we have increasingly multiple chronic conditions that are hard to manage and to treat. So we're going to be exploring together with our experts, what could Europe do? How could we make a difference on the life of our European citizens? Now, just a few months ago, in December 2023, the Public Health Subcommittee of the European Parliament adopted a report looking at NCDs, and they highlighted areas where we can make progress in prevention and looking at ways that we can support better management of them. And we'll have a chance to highlight some of the key messages that came from that report, and we'll have an eye going forward to see what can we expect in the next few years. So, without any further ado, and I will be introducing my speakers who will come next, let me now invite you to hear from Rachel Nugent. Rachel is a Senior Technical Director for the RTI Centre for Global NCDs, and she's joining me to help us understand particularly the aspects of health economics. And we're going to explore issues of where we've got the data, how much data do we have, where are the gaps, how do we use that data to build the evidence base for convincing policymakers to take action? So Rachel, let's see if we can join you online.
Yes, thank you so much. Let me know, signal if you don't hear me, but good afternoon. Thank you to the honorable members present and to the European Chronic Disease Alliance for inviting me to say a few words about the economics of NCDs. I worked in this area for almost 25 years, and I've observed the leadership from the EU in the past, and I'm excited about the future steps that will be taken by the EU to reduce the NCD burden in your region. The EU, the European CDC is a great example of how Brussels and European countries produce and rely on high quality data and analysis to generate effective policy. And so we know a lot about the epidemiological foundations and implications of NCDs. These are well understood, although more information would be useful. But the economic impacts are largely unknown, and information about them is particularly fragmented. And this leaves policymakers in a void when it comes to prioritizing their attention, which is always limited, and their investments across policy and program options. So let me give a few examples of the kind of global knowledge that we do have that might be useful in EU countries and in the region, just as a starter for us thinking about the economic information that's valuable. The WHO created a global NCD investment case that estimated the implementation of the best buys. The best buys from WHO are the most cost-effective interventions for prevention and management of NCDs, and there are many of them. The evidence has been developed in different countries and different regions, not only in high-income countries, but also in low-income countries. And the implementation of those best buys would cost an average of 84 cents per person per year. in low and middle income countries. That kind of information is not yet available in all European countries. Another example, healthy diet interventions offer a return of nearly 12 to 1. And tobacco control offers a return on investment of $7 per dollar or euro invested, and alcohol reduction more than $8 or euros per dollar or euro invested. One more example, and then I'll move on to what we need to know in Europe. An analysis conducted by The Lancet in the NCD 2030 countdown showed that an $18 billion investment globally would avert over 39 million deaths and generate a net economic benefit of $2.7 trillion or 390 per capita. All of those could be converted to euros. It's the same ratio. But there is much that we don't know. And let me give you a few thoughts about what kind of data can help fill the void, that economic information void, and bring additional evidence about the economic impacts of both action and inaction, and the most cost-effective actions to your decision making. First, what's important to a policymaker? I mean, in all humility, I would have to count on you to tell me what is important. But we have experience in dozens of countries telling us what they want to know in regard to the economics of NCDs. You want knowledgeable information sources, reliable and credible information, above all, that addresses the well-being of your communities and multiple constituencies in your community. So what kind of data should be available to do that? For instance, longitudinal data. We know that NCDs are a long-term phenomenon. They develop over a lifetime and they last for a long time. So policymakers need to know, are things getting better or worse? What should we be watching? And this is where disease registries and surveys provide us with very good epidemiological data, but they should be accompanied by economic information on access to prevention and care, costs, and what influences health seeking and health providing behavior. So both on the patient or population side and on the health system side. An example, we're working on air pollution in a number of countries. We know that that's a very long-term phenomenon, but we don't have good information, localized information about emissions, exposures, and the costs of treatment. A second example, we know that NCDs start in infancy or before, and we need to understand the lifelong effects of early exposures on adult opportunity, adolescent and adult opportunities for education, for income, and other things that matter in life. We did an adolescent mental health investment case, for instance, that showed very high return on investment for early treatment, early screening and treatment for anxiety and depression. Another example for adolescents, we worked with UNICEF to show the lifetime economic impacts of child and adolescent obesity in several countries. And those countries are now taking preventive action, very, very important, across the world. Let me focus then on a few specific kinds of data that I would encourage you to think about on the economic side. We want to have, in addition to the longitudinal data that I mentioned, disaggregated data. We know that men and women are different. We know that people are different at different stages of life. So we want to know who is affected and how much they're affected at those different stages and in those different groups. So big differences in men and women, for instance, in colorectal cancer, the risk exposures, the treatment, how well the screening tests for colorectal cancer work in men versus women is very different, and even attitudes about screening are very different. So while there may be a similar incidence of colorectal cancer, the mortality can be quite different because of those kinds of things I'm mentioning. Similarly, in terms of disaggregated data, we know that women are by and large the main caregivers, the main unpaid caregivers. And we did some analysis that showed that across several countries, 2 to 4% of health expenditures, of the value of health expenditures, are being provided for free by women just for cancer caregiving. That's work that's in our recent Lancet Commission on Women and Cancer. You can look up. So health economic data, those two examples, the disaggregation and the longitudinal aspect, are really important in many different ways we can address that. Europe is not alone. Just to summarize some of the kind of information we look for around the world that I think Europe could be a leader in developing. Of course, the cost of delivering services, including screening and management, and the cost of policy implementation. We don't have very good measures of how much does it cost policymakers to develop and implement population level policies, especially, for instance, the costs of tobacco, alcohol management control, and good dietary policies. Costs of treating multiple chronic conditions and how we can achieve efficiencies in integrating caregiving. We need disease-specific and industry-specific measurements of the impacts on productivity. We have some of that from some countries, primarily from Australia and the US, but we need them in Europe too. And we need transparency about medicine pricing, which purchasers need to know, and it's not very transparent. I will wrap up here in just a moment. We need to know the costs of the out-of-pocket costs that patients and their families face, because that is often significant in many countries, but we don't know that those numbers very well. We need to do surveys. We want to also do some methodological advances, which the EU was well placed to do because of your expertise in these areas, such as on health taxes and how to harmonize health taxes, and how to address whole of society actions, like measuring the co-benefits of multi-sectoral actions in, for instance, the transport sector, the education sector, sports and recreation, and set targets for those sectors to address NCD prevention. So I will stop with that and turn over to the moderator, and we'll come back maybe to, if you have questions about any of those aspects, I'm happy to address them in our discussion. Thank you so much.
Thank you very much, Rachel. Really interesting to hear actually how cost effective it can be when we can put policies in place. And, you know, when you think about the savings you get in a bank account, it's very poor at the moment. But imagine if you invested that money, if you banked it in your population on tobacco control or alcohol control, diet interventions, what an amazing return on those investments. So thank you for sharing the really, hard data, but also indicating we need to collect more information, longitudinal, disaggregated, that will give us more granularity, more clarity about how do we need to do policy measures that are targeted, which populations are most effective, and what would it cost to implement those policy measures. So thank you. You really set us up very, very nicely for this debate. Let me now invite Stefan Schreck from the European Commission to join me. He's an advisor on stakeholder relations for DG Sante, the part of the Commission that has responsibility for public health. And what I'd like to ask Stefan is, we're about to have a phase 2 of the Healthier Together initiative. What I want to find out from Stefan is, what does that look like? How would that strengthen the things we've just been talking about prevention and promotion and management of NCDs? Stefan.
Yes, thank you very much, Tamsin, and hello to everybody. I'm happy to give you an update on what comes next under Healthier Together. I start with Jacadi. Last November, a key joint action started, which is called Jacadi, that brings together 21 European countries in a joint effort to reduce the burden of cardiovascular diseases and diabetes. It has a budget of 53 million euros, and it will pilot 142 projects across Europe, covering the entire patient journey. This week, another major joint action is being rolled out. The joint action Prevent NCD on addressing health determinants of cancer and other NCDs has an unprecedented EU funding of 76 million euros. And it also has ambitious objectives. First, it will improve the joint capacities of member states to plan and implement prevention policies and activities, so it's capacity building. Second, it will also improve the monitoring system for non-communicable diseases and their risk factors, so we hope that actually indeed we will have better data in the future on non-communicable diseases at European level and also at national level. And third, it will also contribute to close health gaps between and within countries. And while the joint actions are only for governments and health authorities, a number of projects implemented by stakeholders and civil society are also being rolled out to support the efforts of the member states in these two joint actions. Support has also been given to Prevent other NCDs not specifically addressed under the strands of Healthier Together, such as kidney disease, for example. Then the Commission has adopted a communication on a comprehensive approach to mental health that is comprehensive, multi-sectoral, and prevention-oriented. It focuses on the needs of vulnerable groups such as children, young people, migrants, and refugees. The Commission also supports Member States in their work to address the key risk factors for non-communicable diseases such as tobacco, alcohol, and diet. We are carrying out an overarching evaluation of the legislative framework on tobacco control. On alcohol, we are working on gathering evidence to support the provision of information on nutritional content and health warnings on alcoholic beverages.
Good luck.
A healthy diet is important from the start of life for the child's development and to establish good eating habits very early. The Commission therefore resumed work to revise baby food composition requirements and health claims targeting infants and young children. The Commission is currently also preparing actions to support sustainable public procurement of food and catering services. This will include criteria for a healthy diet in schools and public institutions. Then we launched the Code of Conduct on Responsible Food Business and Marketing Practices. This will contribute to a food environment that makes healthy and sustainable food choices easier. The Joint Research Center launched in September last year the Food and Beverages Labels Explorer. It will support the monitoring of the food environment and the success of national food reformulation initiatives. It builds on data collected by the previous successful joint action BEST Green Map. And then I should also mention that the Commission works closely with the expert group on public health made up of nominated representatives of the Member States. That group assists and advises the Commission in the preparation of policies, activities, and legislative initiatives to address non-communicable diseases. The Commission will continue to support Member States in reducing the burden of NCDs by taking a holistic approach, focusing on health promotion and disease prevention. This approach will address a wide range of health determinants, for example, healthy diets, physical activity, tobacco, and alcohol use. It will support the reduction of health inequalities within and between EU countries and regions. This approach was confirmed and supported by the expert group on public health in its meeting last December. The expert group agreed on prioritizing support in 2024 on health promotion and prevention of NCDs and the determinants of health. Through the EU Best Practices portal, we will continue to support Member States to identify and transfer best and promising practices on mental health. Member States have identified this tool as an effective way to exchange knowledge and practices between countries. And finally, under the Work Plan 2024 of the EU for Health program, we will support Member States in stepping up their efforts to promote health and prevent NCDs through joint actions and contribution agreements with international organizations, and also by funding further projects implemented by stakeholders. So that was my update on what is going on in Healthier Together now. Thank you very much.
Thank you very much, Stefan, for providing that very comprehensive overview of the range of different initiatives. And I note that you are covering the whole life course there, from infant formula and feeding right the way through to children, adolescents and adults. So great to hear that approach, which will help look at the promotion, prevention and right the way through the life course. Let me just come back to Rachel for a moment, because you identified for us that we aren't necessarily putting the right bits of data together. So we have epidemiological data which tells us prevalence of disease, but we need to somehow connect that with data on access, the cost of treatments, etc. So can you just take a minute to tell us a little bit more about what particular data you'd like to see Europe connecting together to get a better picture of what's happening on its NCDs?
Yes, thank you, Tamsin. Sure. I'll give you an example of how we've done that. We have prepared what we call investment cases in more than 50 countries, and they may be investment cases about NCDs broadly that cover a range of risks and conditions, or very focused, for instance, on adolescents and children, or on just tobacco. So when we do that, we do combine the epidemiological and the economic information that we have. And we say, when we put those together, how can we help policymakers prioritize all of the options that they have available? So we look at the evidence that is available about what things cost, about mortality, of course, mortality and morbidity, about what kind of prevention and treatment interventions and policy interventions are available, and what countries are doing so far. And that's one of the things that is the hardest to pin down. What is the current status of the policy and health services environment? Often staff in ministries of health don't really know. And so even just good tracking of what's being done, how far along the sort of policy path a country is, are they at the very early stages of addressing, say, alcohol issues or tobacco issues, or the early stages of screening for cancers, or are they pretty far along? Because that will affect how expensive it is to do more and the benefits, the economic benefits of doing more. So I would say, use the epidemiological information you have, do some more investigation on where you are now and how much it costs now and how much it would cost to do more, and put those things together to give you some results that help you prioritize in your decision making over time.
Excellent. Thank you very much, Rachel. That's extremely useful for us to understand how we can use these different elements and bring them together to get a stronger picture so policies can be made based on real evidence. I'd now like to introduce Kasia Lindeberg, who is an advisor for Europe for the International Diabetes Federation. And she is a patient advocate and has a broad range of experience across chronic diseases. Kasia, I'd like to ask you, from a patient perspective, how can we improve the NCD care pathways? And based on that, what does that mean for the policies we put in place for NCD prevention, promotion and management? Kasia.
Thank you, Tamsin, and thank you to our MEPs for having me. I think that if we want to improve care pathways for NCD, we need to make them patient-centered and person-centered. So we need to consider the whole person, the physical aspects, the mental aspects, emotional aspects, and practical aspects. And in my view, an important part of that is integrated care. Ensuring that we have strong and integrated healthcare systems models in order to address the actual needs of people living with NCDs, and especially people living with multiple NCDs. Because we know that one NCD is often accompanied, unfortunately, by another, whether that is through autoimmunity or as a complication, as a comorbidity of the first one. And often when you live with NCDs, and I know this myself, I live with, over half a dozen NCDs, you become the project manager of your own healthcare, and not only your self-care, but your hospital-based care, your interactions with healthcare professionals. You become a coordinator to a very large extent, and that's not necessarily the most efficient way of doing things. I would say it's hardly ever the most efficient way. And from a patient perspective, not only does it become tremendously energy consuming, which is in addition to the strain that living with multiple conditions already entails, it's also very time consuming. And that's time that could be spent on other things, whether that's for the benefit of the individual or for the benefit of society. So in my view, there's a very strong need to move from this fragmented, episodic care that we have to a more continuous, coordinated, integrated care that's designed around the needs of people living with NCDs around their lives. And that, in my view, entails bringing together different streams, different levels of care, whether that's educational aspects of care, it's primary care, secondary care, mental health services, which is often a very big part of living with NCDs, secondary prevention and rehabilitation as well. And it's putting people living with NCDs at the center of their care, recognizing their specific needs based on their health conditions. And I think, and to connect to your second question, what this means for policy, I think in order for this to be successful, people with NCDs need to be at the center, not only as patients, but as experts on the lived experience, as experts on what it means to live with NCDs. And that means genuinely involving them in the design and the planning of care models or programs, in the implementation and the evaluation and policy making of healthcare systems and care models. And that doing that in a meaningful way and not in just a tokenistic manner we know that it makes the outcomes more relevant, it makes them more efficient, effective, it makes them more sustainable. So basically, I think integrated care models, person-centered approach, and involvement of people living with NCDs as experts, because engaging the target populations as experts in our own right in the decision-making process and letting us speak for ourselves as opposed to having others speak on our behalf will result in better care models and greater ownership and better responsiveness.
Excellent. Thank you very much, particularly for sharing the perspectives of patients, what it's like to try and navigate through the system. And I highly recommend that message that individuals with chronic conditions, particularly multiple conditions, have to project manage their own care through the system, because they are the point of care. Let me now turn to Maria Neufeld, who's here from WHO Europe, and you are the Technical Officer for Alcohol, Illicit Drugs and Prison Health. Now, we heard from Rachel earlier that the WHO has created best buys for policy responses. Now, alcohol is a peculiarly European problem. We're the region that drinks the most in the world, significantly more than everywhere else, and of course, we get a significant amount of alcohol-related harm. We heard from Stefan some of the things that the Commission are putting in place, but what should Europe's priorities be? What we should be doing next on alcohol?
Thank you, Tamsin. Yes, you are absolutely correct. Alcohol is a very important risk factor for European health, and that's also very important for the European NCD agenda. And speaking of the UN high-level meeting that you mentioned, like in 80 weeks from now, member states will gather in New York at the UN Assembly, and they will discuss progress made towards the targets. And unfortunately for EU member states, there will be not much progress to report on, because if we look at the recent data that we have, EU as a sub-region did not make any kind of progress, no change between 2010, when the target has been set, and 2019, where we have the latest data. There were no changes, and alcohol remains, well, simply too cheap, too affordable, too available, and too heavily advertised in EU. And that's why we're seeing, basically no progress. However, in 2022, member states of the entire WHO European region have adopted a very important framework, a new framework on alcohol action that is based on the most recent evidence, and it identifies 6 priority areas where member states can take action to change the situation. And we will see a short summary of this in a video. And as you can see, the best buys, the 3 best buys, increasing taxes, decreasing availability, and decreasing or limiting alcohol marketing are at the very heart of this framework. So speaking of the next logical step, or the priorities, well, I think it's quite obvious that EU should consider aligning as much as possible of its strategies, of its policies with this framework. And if we look historically, well, EU has the first and only EU strategy that expired over 10 years ago already. And obviously there is this possibility, and just to say WHO will be very happy to support that. But also looking at the opportunities that we have right now, I think the EU Beating Cancer Plan is a very important document, because it makes very, very important commitments to better alcohol policies. And one important area is the revision of the tax directive, of the tax rates. And this is coming also back to what Rachel was saying. This is such a crucial area. I cannot emphasize enough how much untapped potential we have in this area of alcohol taxes. we can design alcohol taxes as health taxes. Think of all the benefits of, first of all, reducing the harm, the burden, the treatment burden, and so forth. And secondly, having direct state revenue from taxes that, like we can invest more of those really great programs that Stefan was presenting, for example. And the second very important commitment of the EU Beating Cancer Plan is, as also Stefan has mentioned, is the implementation of better labeling provisions and health warnings, which I think is really a game changer.
Thank you very much, Maria. And I know we're going to be sharing with the audience different graphs and images which show just how disappointing it's been that we haven't made any progress on alcohol consumption patterns and the related harm, health harm, social harm, societal harm that come with that. So it's clear that the top of the to-do list for the new mandate for the incoming Commission and Parliament should be to pick up and try to make some progress, because to go to the UN meeting and show we haven't made progress, will be not a high point for European action on chronic diseases. Let me now pass to Professor Raymond van Hulder. You are the chairman of ECTO, which is the European Chronic Disease Alliance, and of course you have a specialisation in kidney health. One of the things that's quite interesting in the European Parliament's report is they highlight the issue of secondary prevention. And why is secondary prevention so important, and how do we make progress in it? How do we move beyond what people understand as primary prevention and take it to that next level?
Yeah, okay, I think also out of my personal specialization, where kidney disease quite often comes at the end of a profile of many other diseases, starting with obesity, hypertension, cardiovascular, etc. And then on top of that, with a disease that creates all kinds of complications. Cancer, cardiovascular, very important for us. So we know quite very well this kind of spider net of chronic diseases that all go together. They are in one single basket. I'm against this kind of silo mentality where specialties stick on their own. So I'm very much in favor also of common consultations, that diabetes and kidney and cardiovascular and kidney go together, because I think it's a profit for the patient, and it's also for the medical specialty a very big advantage. So secondary prevention is something really to be considered. We have been focusing since many years on mortality of per single disease, and that's of course a very important information. But what's happening while they are developing 1, 2, 3, 4, like Kasia, 6 different chronic diseases that come on top of each other and that are really worsening their quality of life and spoiling their own life and the life of their families and people surrounding them. So I think we have to view, like Stefan Schreck said, the thing more holistically and really consider everything together.
Thank you. And you also mentioned that it's important to identify early, who's at risk, so that we can, move them towards appropriate checks. But also there's a little risk that, people get sent to specific checks, and we don't say, well, if my mother who's 82 goes to hospital to have her heart checked, there isn't necessarily an automatic thing to say, check your kidneys, check something else. So how do we make sure that happens?
Yeah, that's another point. I think I'm very much in favor of early screening. So we now come much too late. But also I'm much in favor of looking, and sometimes they do not exist, but sometimes they do exist, for common markers that are focusing on several different diseases. So, for instance, to give the example of albuminuria, that's one single urine test. It costs at maximum €5, but if you can make it cheaper. And it screens for the risky patients with obesity, with hypertension, with hyperuricemia, with kidney disease, with cardiovascular disease, diabetes. So everything in one basket. So therefore, I'm in favor of early screening, but also of deciding on screening methods that are not expensive and that have a maximum benefit for screening as much people as possible.
Thank you very much. And you've brought us back to some of the key messages that we got from Rachel at the beginning to show that actually you get a great return on investment for different forms of prevention. And you've showed us that actually screening can be a really important part of that, and as well secondary prevention, making sure that people who do have a chronic condition, that they are supported, especially if other conditions come forward, that we maintain that focus on screening and supporting well-being throughout the life
Not
course.
only screening, but also action afterwards, of course.
Very important. Thank you. So we've heard from many of our stakeholders around the table, giving us perspectives from the WHO, giving us perspective from the professionals, from patients, trying to understand, what the potential is for Europe to do more and to do better. So now I'd like to come back to our MEPs who've been listening very patiently to this. And first of all, let me ask you both a little bit about the SANT report, which was the Public Health Subcommittee's report just been published on prevention and health promotion. What does the report identify as the top areas that we need to work on? So Tilly, let me invite you to reflect on that.
Thank you very much for giving me the floor. And I think what is very important, and really, I think the report also focuses on the prevention, that there is still a lot of work to do in that sector. Mainly, it was already mentioned here. But I think that point is one. We know that 630,000 deaths are attributed to environmental stress factors. So let me point out two elements especially is the impact of the environment that we need to tackle more, so speaking about the preventional part, and then also to address better the different population also who are especially at risk. It was already also mentioned by Professor Rachel Nugent that we need also more data on specific population, and we know that 70% of the NCDs could be prevented. So really, there is some action to take. So that's something that the report acknowledge, and also the idea of this holistic view that is needed. So we know that social, economic, and also health inequalities play a very important role. So, and in order to have this holistic point of view, we need to think about health in every policy. We need a more coherent approach at the European level, and also consider always the aspect of One Health. Because when we speak about environmental risk factors, what am I speaking about? Of course, I'm speaking about air pollution, I'm speaking also about water pollution, soil, but also our food, the diet, what we are eating is important. We speak about chemical exposure that is there. So for me, it's really not the moment to weaken down a farm-to-fork strategy or a Green Deal, knowing the impact that it has also on human health. So that's definitely something we need to act. And then speaking about specific populations or populations that are more at risk, I speak about so-called more vulnerable population, more marginalized population. Refugees were also already mentioned. So we need also for this population to guarantee prevention, but to guarantee also diagnosis, to have the screening, to have also afterwards the adapted treatment regarding this specific population, where the risk of unhealthy diet is even higher, where the risk also of not having enough physical activity, etc., might be higher. But then speaking also about availability and accessibility of treatment afterwards. So now we're working intensively also on the pharma package, on a pharmaceutical regulation. And I'm happy that we tackle not only there the fact that we need innovation in treatment, but it's not enough to have innovation if it's not accessible, affordable for the people afterwards. So that is another point I wanted to mention here that we tackle and that we speak about at the level of the European Union right now.
Excellent, thank you. Sarah?
Yeah, this report, the NCD's report by the European Parliament, is quite an ambitious report. It tackles the different stages of non-communicable diseases, since exposure until treatment and quality of care for the future. However, it's important also to reflect that we had a EU beating cancer and we did not want to leave all the other NCDs behind. So this report takes into account that. But it's important to reflect that the European Parliament is still composed by politicians. And what happened in this report is something that it's quite harmful for science in regards, and I use that word in particular. What we see is that it's not in line with the latest scientific knowledge out there, and I'm speaking specifically on alcohol consumption. This report takes a step back when it comes to the Beating Cancer report and established that there is moderate or kind of taking the idea there's a safe limit of consumption of alcohol that does not jeopardize your health. And what we know is that's not accurate. For cancer, for instance, there's no safe limit of alcohol intake. That was one of the main reasons I abstained in the report, even though I'm very much in favor of the report. I could not, in good conscience, and coming from the scientific field, vote in favor of a report that takes an important step back, because we think it's only one word that it's not there, harmful consumption. And we wanted to remove harmful. It's just a word, but that word is what will take the industry to still push forward more marketing, less taxes, more availability to a substance that we know it's very, very harmful, not only for the individuals, but has an important societal impact. So I would like to take and leave that reflection there.
Thank you, and indeed that's really important given what we heard from Maria, that we just haven't made the progress we need to in the European region on tackling alcohol consumption and therefore alcohol health harms. Okay, Silly, let me invite you to give us a little bit more reflection on the proposed EU-wide comprehensive strategy on NCDs, which of course would be reinforced by specific plans and measures like the Beating Cancer Plan, mental health approaches. But tell us a little bit more about that comprehensive strategy.
Yes, I think first of all it's important to realize that the EU can do a lot regarding health issues, even if some policies are outside the competences really of the EU and more at the member state level, but that is sometimes also used for some not to act. So I think it's very important to have such a strategy to provide a more structured and coordinated approach, as well as to optimize the resources at national level, but also to align policies for a more effective response to the growing challenge of NCD. So it's really about aligning policies, make it more coherent, and optimize all the resources, as I said. But also at the European level, and we know that there is still a lot of data, for example, missing. We would be able also here to monitor progress in making it more transparent and also in a more accessible way. So we need to have a more holistic and a more equilibrated approach, not that we have some cherry picking, speaking about only some diseases and leave the other ones and also the other patients behind. I'm speaking there, among others, about the neurological diseases, for example. Now we speak a lot about cancer. It's not to put one against the other, but in order we could do at the European level this better monitoring in order also not to leave anybody behind regarding having an NCDs or accumulating several, as we heard also here today from Kasia.
Thank you. Sarah, let me invite you to think a little bit about health literacy. We heard from Kasia about, her need to be a project manager, which means she has to be both literate about the different conditions she has, the treatment options, the health system. We heard from Stefan about the approaches of looking at schools and, health promotion there. How important is health literacy to the management and prevention of NCDs, and, what should Europe's role be?
Yeah, that's a very important and interesting question in regards to health literacy. Means empowering citizens to take active, healthier choices for themselves, and hence you increase the health of the population. EU has a specific method that can actually make a difference in that regard. But I would just like to go back and reply a bit to the different questions that came out there in regards to accessibility of the data. For instance, the EU is now, we are both actually negotiators for our own political groups for the European Health Data Space, which will be an incredible source of data. We're talking about 450 million citizens' health data, obviously with all guarantees of security, confidentiality, and we will have access to this longitudinal data that can then be translated into better information. How will that information feed into us improving the health literacy? It can do through two different ways. And it's important also to take a step back. What can the EU do in regards to health? EU cannot say how countries are going to make their own health systems, how they work. So provision of care is a member state's exclusive competence. But the European Union has shared competence when it comes to protection of public health, and that's where we can target. And there's a lot we can do there. So for instance, Stephen already shared with us the support and sharing of best practices when it comes to secondary prevention. But here we're speaking about screenings. We cannot tell countries how to do the screening, but we can support them in how to better implement these screenings. Integrated care, we can also do sharing of best practices and boost the debate on primary care and the importance of universal health coverage. Also for the EU, that needs to be a reality. But now answering concretely to your question, what can the EU do? It's primordial prevention, meaning legislating on the known risk factors for non-communicable. In regards to health literacy for the citizens, primordial prevention, again, we are going to legislate on labeling. For instance, when we wanted, just to mention in the NCD's report, alcohol labels should have some health warnings. No, there's no space. You're going to change all the bottles. This will be huge for the industry. You're going to kill a big part of, I'm from Portugal, Portuguese economy. I was accused of that, even though we now have wine bottles that have poems on it. So don't tell me that you don't have space for a specific health warning. We need to tackle this labeling, and this was Stella Kyriakidis was an incredible commissioner for health. She did incredible, but we need to go further. We need to improve our labels, not only nutritional labels, on how many calories there is in a sandwich. You see that on Latin America, you see that in the US, you see that in the UK. Where's the EU? I can't see how many calories just a simple sandwich has. Just to give an example, that's health literacy. And another example is on the revision of the tobacco directive. We now have novel tobacco products, and we need to legislate them, even though we are already falling behind. So just giving here 3 examples on how we can have an active voice when it comes to primordial prevention, increasing health literacy, but also all of us from 6 to 9 of June will have a word to say when we're going to vote for the next EU Parliament.
Yeah. If I may add, Sarah mentioned the importance of the elections, and I would really make a call to the people to really look those politicians who really put the patient and the person in the center of the preoccupation.
Yeah. We can hear, oh, this will cost a lot. Actually, the information that we have, the latest evidence is for each euro that we invest in long-term public health interventions, there's 14 euros, 14 euros in return. So nobody can say that's not a cost-beneficial action that we can take.
Thank you. And just before we close, I'd like to ask both of you, you have both championed health in your mandate this time round. And come June, there'll be a new set of people coming in. Maybe there'll be some new people who think, I'd like to do something for health. what would be the top 3 things you'd tell them that they should take on and champion during the mandate if they want to have an impact on NCDs?
Impact on NCDs, the topics I just mentioned, ensure that Commission will come up with mental health strategy, which we ask in the mental health report. I know it's not part of the NCDs report, but it's also non-communicable diseases. Ask the Commission for a revision of the tobacco framework and also the nutrition label. And the fourth, but general, never forget who you are here representing. Each one of us represents 450 million citizens. We're not here just representing Group A, B, or C. So the politicians need to be accountable for the votes and the choices they take.
Thank you. Tilly.
Yeah, the 3 important points is I have to choose 3. There are so many. Even if we did a step forward in the European Health Union, there's still a lot to go. First of all, of course, thinking of empowering patients, informing and empowering patients. Sarah spoke a lot about the needed health literacy. I think that is important. And then secondly, regarding NCDs, but also in general, is providing really like a safety net of critical medication produced by public authority. We have that similar already, and also better coordinating research. We have that more in the United States than we have in Europe through BARDA. Why don't we do that also in Europe? And then in general, I would like to say balancing more the power, as I mentioned already before, between public authorities and really the private pharma industry. We saw how much we are on the mercy, at the mercy of the private sector when we had the pandemic. I think there is some rebalancing to make between these powers. And then last, if I may say, very last thing is, of course, tackling environmental pollution. This is causing so many deaths that we need to tackle that, the environmental. So the whole concept of One Health is to foster how we treat our environment has also an influence on our health, and especially regarding the developing of NCDs.
Excellent. Thank you very much. And I'd like to say to you, thank you very much for joining us for this debate. We hope you've learned something more about the potential for having an impact on tackling the NCD burden, which is across Europe, some hope for the future, some strong suggestions for what the next mandate should do. And I think the message was very clear. We should expect more from our policymakers. We should ask more, and we should use that as part of our voting power to say, this is what we want. You have an opportunity to impact on people's health. Take the decisions from that perspective of improving citizens' health. So thank you very much for joining us, and see you again at another policy debate. Goodbye from Brussels.
Thank you.